I'm Nikko Cabrera, and I'll be doing a newborn assessment or neonatal assessment today. Today we have our newborn, and let's get started. Alright, so once baby has come from labor and delivery, before I start any assessment, I just want to do my hand hygiene, and I'm going to put on some clean gloves. Now, after birth, the first thing I would want to check on baby is my ABCs. So I would like to check if there's a patent airway, make sure the baby is doing just fine, breathing normally, and looking at our newborn here, doing great. After I've identified that my ABCs are all within normal limits, I'll ensure that the baby has 2 patient identifiers. Now that could be 2 bands that are on the legs, or maybe 1 band on the leg and then 1 on the other arm. So after I've had my baby identified with its bracelets, I'll then move on to obtaining my ABCAR score. So first would be appearance. I'll be on the lookout for any like bluish color that could be out of normal. Other than appearance, I'll then move on to pulse. So with pulse, you just check, and with G, ABCAR, which is grimace. Make sure the baby's grimacing, no crying, that's a good sign. A would then be activity. Activity, I don't want the baby to be flaccid, like I kind of want the baby to be moving around like normal. And last would be respiration. So like I said, I checked my ABCs earlier, respirations are good. The ABCAR score would be assessed at 1 minute after birth. And if it's below 7 or 8, I'll wait, maybe put the baby on mom for maybe 5 minutes and then reassess at the 5-minute point. And I'll keep on doing this ABCAR score until I've reached a satisfactory score of 7 or above. After I've done my ABCAR, next thing I would want to do with baby is its medications. So first would be the erythromycin on both eyes. So I'll get my eye drop medication, and from the outer lining, I'll go in and out, and the baby will blink and absorb that erythromycin. Next, I'd like to do the vitamin K shots, which are IMs. So IMs would be done in the vastus lateralis of the leg. So I'll divide my leg into 3 sections. I'll do it in the middle, and I'll take my vitamin K shot on the outer side of the middle portion. And with that, if I want to do my Hep B shot, which is also IM, I'll just proceed to do that on the other side as well. So 1, 2, 3, middle, and on the outside. So after I've given my medications, next would be weight. So I'll go to my scale. I would put maybe like the baby's diaper, the blanket for swaddling. I'll zero out the scale. I'll take baby, support the neck, place baby on the scale, get the weight of the baby, and I'll bring baby back. Alright, so after I've obtained the weight of baby, next we would do is the head circumference. So imagining that I have a measuring tape, I would go from the frontal to occipital area of the baby. I'll wrap around the measuring tape from around the circumference, and I'll get my measurement there. The next measurement I would like to do is chest circumference. So this will be above the nipples of baby. I'll then wrap around the chest circumference of the baby, and I'll get that measurement there. And last, I would like to do length. So length would be from the top of the head of baby to the bottom. Now there's 2 ways I could do this. I could measure the head, make a mark on the blanket, and then as baby is laying still, stretch out the leg, make another mark with a pen, and then with that I could measure my measuring tape. Or if baby is complying and calm, I could just get the measurement and get a good estimate there. Once I've gotten those weights and length of the baby, we'll then start performing our head to toe assessment. So starting with the head, I'll assess baby for any molding that could have occurred. I'll look for signs of caput succedaneum, or cephalohematoma, and knowing that like cephalohematoma occurs only on one side of the suture line, while caput succedaneum would occur across the whole head area. So I'll be on the lookout for that. Next thing I'd like to check on baby is the fontanelles, make sure they're approximated or they're sunken or bulging. So that would be the frontal fontanelle and the occipital fontanelle, and those have like triangular diamond shape orientations, so that will be what I'll be palpating for on baby. Once that's complete, I would like to assess the eyes of baby. Make sure the sclera is clear. Look for any conjunctival hemorrhage, and I would also assess the position of the eyes to the ear. So from this point, you would look at the if they line up with the pinna of the ear. Next, I would like to assess the mouth of baby. So here, I'll just, stick my finger. I'll probably like do the sucking reflex. And with that, I'll check for like cleft lip or a soft palate to see if there's a soft and hard palate, see if there's any cleft palates there. After the mouth of baby has been assessed, we'll move to the neck. And we could assess for any webbing that could be indicative of Down syndrome. Look for mobility, make sure the baby can move the neck around. And lastly, I'll check the scalp once more for any lacerations or abrasions. And meanwhile, I'm checking the skin on the face and neck as well. That will take me to the next step of the head to toe, which is the skin assessment. So I'll look at baby's back and look for assess the skin, look for any Mongolian spots that are commonly found in the sacrum area. I do not want to see any meconium staining. So meconium, like they said in the newborn assessment video, is the baby's first bowel movement. I'll look for that and any birthmarks, lanugo for hair. They said there's vernix. Don't scrub that away because vernix is a bacteriostatic, so it's good bacteria. And I could also, while I'm here, check for cap refill, whether that be in the nails of the baby or if I blanch the chest and see if it becomes red again. That means I could check a systemic cap refill. Next, I'm gonna assess the thorax area of baby. I'm just gonna look at the retractions, see if there's any grunting or use of like any accessory muscles. After that, I would like to also tape for breath sounds. So I'll check typically the 4 lobes. There's 5 in a grown adult, but typically you would just see baby being checked for 4 just to see if any lung sounds are abnormal. You check if it's clear. So. And you would check the back as well. So, lifting baby. I could also check for any heart rate rhythm for murmurs, so that'll just be the same as any adult. And this will be in the between the 4th and 5th intercostal space. All right. Once I've checked the heart and lung sounds, everything seems normal here. I could move and check in the brachial and femoral pulses of baby. So brachial would normally be right above the antecubital area. And I'll check both sides to make sure that they're equal. And the femoral pulses as well. All right. Next, I'm gonna move up down to the abdomen of baby, and I'll just look at the shape, make sure that's normal. I could look at the bowel, listen to bowel sounds as well, and I'll be in the normal fashion of an adult. So, starting from the right lower, Open up. Alright, and I'll just wait and listen for bowel sounds, and if I don't hear any, I could probably like maybe move baby around, or I'll just wait until I finally hear that bowel sound, anywhere from like 1 to 5 minutes. Next, I'd like to look at the umbilicus. So typically the umbilicus will have three vessels, so that would be the 2 arteries and the 1 vein. So I'll check for color and shape, make sure I could assess and count, make sure each vessel is accounted for. Next, I'll move to the genitalia area of baby. So depending if it's a female or a male, starting with the female, the major parts I would be seeing is the labia majora. So labia majora should be covering majority of the genitalia area. If it's a male, I would assess for the penis and the scrotum as well. I could also just touch and feel for the testes. They'll feel like marbles, and with that, I would also assess for rugae of the scrotum. After that, I would just, while I'm here, look at the anus. Just make sure that the opening's there, make sure nothing looks out of the ordinary, and I'll call it a day there. Next, I'm gonna have baby just turn around, and here we'll assess the spinal column, and just make sure that it's midline, intact, there's no dimples, and it's straight. Looks good here. Put baby down. Next, I would probably look at the extremities of baby. So going through each extremity, I'll make sure and count the digits, make sure there's 5 fingers, 5 toes on each end. While I'm looking at the digit, I'll probably look at the palmar creases, make sure there's a good amount of creases that will give me a good estimation of the age of the baby. Look for webbing or any polydactyly or synodactyly. When I'm at the feet, I'll look at leg creases and leg symmetry and arm symmetry, and make sure that baby looks good there. I can also check if the clavicles are intact and that the feet are positioned correctly. I can also look at the bottom of the feet, make sure there's good creases there that will indicate a normal age. Moving on to the reflexes, we have the Moro reflex. So while the baby is just resting, I'll slightly pull the arms and drop baby, and they should startle. Next would be the rooting. So if I just scrub the cheek of a baby here, the baby should turn their head that way. Grasping, if I put my finger at baby's hands, they should grasp the fingers. I checked sucking earlier, but if you put your finger in the baby's mouth, you should feel a sucking sensation of the baby. Next, I'd like to assess the stepping reflex. So I'll just carry baby here, and baby should start walking a bit, although this reflex is going to disappear in a few months. Lastly, I'm going to check baby's Babinski reflex. So at the feet, I'll do a J motion, and when I do the J motion on the sole of the foot will fan out. So I'll check for that and check for that as well. And if both feet fan out, that means the Babinski reflex is positive and so there. Moving into the last, we're going to check for gestational age and neuromuscular maturity. So with gestational age, I'll just look at the skin again, assess the skin. And while I'm doing this, I'm going to be grading using the Ballad scoring. We have check for lanugo, which is like hair, plantar surface of the feet, the breasts, there should be a little fatty pads in the breast. With the ear recoil should go back just like that for both. And genitals as well, depending on male and female. Moving into neuromuscular maturity, we're going to look at baby's posture, see how they are presenting themselves. square window. So this will be for preterm labor determination. So with the hands of baby, I'm gonna bend the hand and assess the angle that the hand will make. Arm recoil, same. I will usually flex the arms and then pull them back so that they're extended, and then let go and they should flex back up. Popliteal angle, that will be with the legs of the baby, and I will usually bend and push to see when there will be resistance, and that will be graded as well. Scarf sign will be for the arm, so I will be pulling baby's arm, and a more mature baby would not be able to extend their arm completely over their neck like a scarf, so a normal result would be maybe it stops around midline. Last test for neuromuscular maturity would be the heel to ear test. So I'll just extend baby's leg towards the ear, and that will be graded as well for valid score. Once that has been completed and my assessment has been complete, I will probably take baby and give it back to mom, and they could have some skin-to-skin contact and some alone time. All the meanwhile, I will be documenting my findings, and that would be it.